If we move on to our physiological movements of the TMJ, I will often assess these in sitting first and then usually in lying or in supine position as well. But depending on the patient, you might do one or the other. When we're looking at our physiological movements of the TMJ, we are wanting to assess for the quantity of the movement. So we're going to usually measure the amount of movement. And I use a terabyte, like in this picture here, to assess the amount of movement. But some people will use just a ruler, is possible. And some people will use a caliper as well, which is more common in research. So all are appropriate, and as long as you are reassessing with the same instrument, then it's probably appropriate either way. So we're going to assess the quantity of the movement. We're going to ask them. Sorry, we're going to be looking at the quality of the movement. So, is there stiffness through movement? Can you see is there pain through movement? Are they deviating with movement? Is really important as well. And I always ask my patients, does it feel like they're getting full movement? So when they open their mouth, do they feel like they're getting to the maximal amount of opening that they should have, or does it feel limited for them? And that's important as well, because sometimes what the patient, even if they have normal values on measuring, what the patient feels is more important to what your functional outcome might be. So remember, with our physiological movements, we are assessing our elevation depression or our opening. We're assessing our lateral deviation, our side-to-side movement, and our protraction, retraction. So as I said, I usually do them all in sitting, and I will look at my protraction, retraction from the side of the patient, and then I will often do them all in supine as well, and that's usually where I'll measure using my terabyte, the elevation, depression, or the opening, and also their lateral deviation movements. Let's have a look at some movements of this patient. So you can see that she has some deviation on closing and some deviation on opening. So deviation to her left on closing and a little bit of deviation to her right on opening. And side to side or lateral deviation looks pretty even and is not significant, limited one side to the other, no significant deviation there. Sorry, let's look at it one more time. We can see that it's not always exactly the same as well. So even each time she opens, the deviation can alter a little bit as well. So we have to put all the pieces of the picture together. It's not going to tell us exactly what's going on with the joint each time. And remember, we're working with two joints here. So if we have concurrent pathology in one and the other, they might be doing different things, and that might affect the movement as well.